I'm deeply honored by this tribute celebrating my 32 years of service to UCLA. But I would be remiss if I did not acknowledge the people who have been most influential in my life and who helped pave the way for my success. So let me take a few minutes to thank them. My parents. First and foremost, I have to thank my parents, John and Marie Kominski. Neither of my parents attended high school, but they were committed to sending their 4 sons to college, and they both worked tirelessly towards that goal. My mother is a factory worker, and my father is a longshoreman in the ports of Baltimore. Because of their vision, dedication, and sacrifices, my brothers and I became first-generation college graduates. It's difficult for me to name a specific person who influenced my career development during college, but my collective experiences at the University of Chicago prepared me extremely well for my career, because I finally figured out, through a slow and often painful process, that by pursuing a graduate degree in health policy, I could combine my newly discovered interest in being a researcher with my long-held desire to fight for a more just and equitable society. So, I took a leap of faith and went on to graduate school at Penn immediately after college, where I met 2 people who played crucial roles in my career development. Brian Dowd. I met Brian during my first year of public policy school at the University of Pennsylvania. Brian was a few years into the program and the only other student interested in health policy at that time. His friendship and guidance during my first 2 years of graduate school helped reassure me that I had chosen the right field of study. Brian has had an enormously successful career at the University of Minnesota School of Public Health since 1980, and it's been my pleasure to have him as both a friend and colleague for over 40 years. Sankey Williams. One of the many ways Brian Dowd helped my career was to introduce me to Dr. Sankey Williams. Sankey was one of a core group of physician health services researchers in the medical school at Penn, and it's very unlikely that I would have met him had it not been for Brian, who was working with Sankey on a project that I joined and that led to Sankey chairing my dissertation committee. I have thanked Sankey personally several times over the years for helping launch my career. And as I've told him, every doctoral student I've mentored during my career has benefited from the same patience and dedication he showed me. Since joining the UCLA faculty in 1989, several people have been key contributors to my success. Ron Anderson. Sometime around 1993, Ron invited me, along with Tom Rice, to a brainstorming meeting to discuss how best to use a gift from Sam and Audrey Tibbetts. The result of that meeting was a plan for a textbook entitled Changing the U.S. Healthcare System, which is now in its 4th edition. I am so grateful to Ron for giving me the opportunity to be a co-editor and to learn how to manage the production of a textbook that has both been widely used in the field and that has generated significant royalties for the department over the past 25 years. Tom Rice. Tom has been both a close friend and colleague since he joined the department in 1991. Our joint publications and other project collaborations stand out as some of the most satisfying experiences of my entire career. From day one, Tom has always been extremely supportive of me. I cannot thank him enough for always making me feel that he is in my corner. And I also have to thank him for making me a better tennis player. Rick Brown. Rick invited me to join him as a founding member of the Center for Health Policy Research in 1994. Rick taught me the value of working directly with policy advocates to make a real difference in the ongoing fight for health equity. Looking back, I can say without a doubt that my work at the center allowed me to achieve the dream I had early on in life, to make a difference, and that Rick was an ideal role model in helping me become a more effective voice for social justice. Nadi Parat and Dylan Roby. During the past 20 years, Nadi and Dylan have been my most frequent, co-authors. Without Nadi and Dylan, it would have been impossible for me to build the Health Economics and Evaluation Research program at the Center for Health Policy Research, which today Nadi so capably directs. And Dylan and I work closely to develop, with colleagues at the Berkeley Labor Center, the CalSIM model for projecting the impacts of the Affordable Care Act and other significant changes, including COVID-19, on health insurance markets in California. I am so fortunate to have had two such creative and productive collaborators. Linda Rosenstock. Linda asked me to be Associate Dean of the school in 2001, at a time in my career when I really was not looking for new challenges. But I knew that I could learn more about leadership from her, and Linda's support and advice have been invaluable to me for the past 20 years, particularly during my tenure as director of the Center for Health Policy Research. I'm very grateful to still have her as a friend and colleague. My family. Finally, I need to express my deepest gratitude to my wife, Laurie, and daughter, Julie. Julie, thank you for the opportunity to experience the glorious wonders of being a father. You've enriched my life in countless ways. And Laurie, well, for those who haven't heard me say it before, for years I've said the best things in my life happened after I met Laurie. It has been an amazing journey since we met playing softball at Penn in the summer of 1982, and I'm so lucky to have had you to share this joyous adventure for the last 40 years. In closing, thank you to the thousands of students I've had the pleasure to engage with over the past 32 years, many of whom were first-generation college grads like me. I hope you learned as much from me as I did from all of you. Thank you.